My name is Dr. Dan Nelson. I was head of our cardiology division at one of the 12 largest multi-specialty medical clinics in the United States for 11 of my 22 years of practice. I am currently a working interventional cardiologist and have been treating patients with angioplasty since the early 1980s. Since then, I have been fortunate to use directional atherectomy, coronary thrombectomy, laser techniques, and rotoblator catheters in the ensuing 15 years for both elective and emergent procedures. I have inserted all types of coronary stents as they became available since the early 1990s. These techniques have been premier breakthroughs in the history of medicine for the treatment of our patients. Unfortunately, these gratifying treatments we talk about will in no way prevent the primary problem, which is rampant disease of the body's arteries, an epidemic that is responsible for 50% of the deaths in the United States year after year and is brought on by the inability to control cholesterol in our diets as a major factor. When we talk about alternative and preventive care for our patients, I would confirm to you that physicians in general are quite skeptical of these products, and cardiologists are without a doubt one of the most skeptical groups. However, I was quite intrigued by the initial discussion I heard, and in view of my family history of coronary disease, I have since used BioSlife in combination with my current statin drug. I've dropped my total cholesterol to 105, a full 70 points below a respectable level with the statin drug alone, and my bad LDL fraction dropped to 60, 35 points below the previously thought adequate level achieved with the statin drug alone. In addition, my triglycerides dropped 60 points to 50. I was astonished that this great formulation could do this for me and was convinced that it should do the same for many of my patients. It gives me great pleasure to introduce it to my patients, a great many of whom are on fixed or limited incomes with staggering prescription costs for more expensive forms of therapy. Many of them have already experienced great results.